Please allow me to invite to the high table the head of Department of Ophthalmology, Professor Adeoye. You're welcome, ma. Thank you so much for being here. And of course, we cannot have a high table without the celebrant of the day herself. So with an ovation, because she deserves it.
Just before we do that, let's also recognize Her Royal Majesty Olori Toriola. That's the Olori of the Ogunshua of Modakeke. You are welcome, ma. Have you?
And now, with an ovation, because she deserves it, please let's welcome to the high table the celebrant herself, Professor Adenike Adeoye.
Jam your hands together for this elegant young lady at 70. While we remain standing, let's take the national anthem, followed by the Great Ife anthem. While we remain standing, let's take the national anthem, followed by the Great Ife anthem.
Not going to fly today. This is the Awolowo University, live and direct. Thank you very much, ladies and gentlemen.
Why is Prof jealous? Not where Owo is fighting over land with another town.
Very quickly, ladies and gentlemen, let's move to the chairman's opening address, and I'll give the mic over to the chairperson. Please let's give a round of applause.
This is the day that the Lord has made. We will rejoice and be glad in it. This is the day that the Lord has made. I stand on the existing protocol because this is the first time I'm in a hall full of doctors. Full of doctors. We are here to celebrate three important things. One, to celebrate this young-looking, delectable, attractive, humble, godly, fashionable lady. I was reading the tributes that people have written about her, and I felt God is awesome. God is indeed awesome. He's the only one who knows what he wants us to be and how he can pattern our feet in that direction. So, Nike, congratulations. Congratulations. We are also here to celebrate scholarship. Scholarship. Scholarship, particularly for a female who, despite her gender, was able to achieve. Nike, congratulations again. We are here also to celebrate old age. Because whether we want to believe it or not, we age every day. And as I said in one of my earlier lectures, aging is not an emergency. We all age every day. How we age, when we age, depends on the plans we have made and God has allowed to come into fruition in our lives. So, Nike, start getting ready. Old age is real, and it will come to all of us at different times. So my prayer is that you age gracefully, that the Lord continue to sustain you, to uphold you, and to bring out those things still in you that he wants humanity to benefit from. We are also celebrating scholarship on a wider dimension, because I've spoken about scholarship with respect to gender, having to cope with raising children, and yet making a success of a career. We are also celebrating academia on a larger field, whether male or female. She has worked as academic for 42 years. She's retiring gloriously, happily. It's not always the case, as we all know. It's not always the case. It's a special grace of God that allows you to enjoy this. And it's my prayer that we will all enjoy our retirement when it comes. The other thing we are celebrating is retirement as a process. Retirement doesn't start the day you retire. Retirement, the day you take up your employment letter, you already know there's a date scheduled for your retirement sometime. Again, Nike, you have been very lucky. You have retired well. You retired gloriously. Your colleagues are still singing your praises, wanting you to stay if you could, but they should tell the federal government that you are 70 and that you can't stay a day longer, even if we want you to stay. So I welcome everybody to this lecture. We have all come to be enlightened. Blindness is a serious matter, and that is not surprising that being an ophthalmologist, is that what you call it, ophthalmologist, has chosen the valedictory lecture to focus on this issue from which we can all benefit, because whether we are blind or not blind, whether we have issues or don't have issues, we need to be aware of this scourge in our society. I hope that at the end of the day, our lecturer, again, oh, thank you very much for coming. I tried to read up on your what's it called, profile in Google, and I said, gosh, how lucky can I be to be here to listen to the lecturer on this very important topic. Thank you for coming. Thank you for honoring Nike. Thank you for honoring all of us, because we will go back blessed. We will go back with greater knowledge about how to prevent it, how to manage it when it comes, and what to do even as we are growing up to ensure that we do not in any way compromise our eyes. Thank you, everybody. Just relax and listen. I can guarantee that we will not live the same. Thank you very much.
Well, another round of applause for the chairperson. Thank you very much, Ma, for making it very brief, straight to the point.
Again, let us start. Let us continue to welcome our guests in the house. Please allow me to welcome our very own Professor Katie Ijadunla, our former provost and now the Vice Chancellor, Ile-Ife University. And again, we congratulate him. Just entering into the hall right now, we have the former Vice Chancellor of this great university, no other than Professor Eitope Ogunbode. Thank you very much for being here.
You're welcome, sir.
Thank you, sir. We also have some of our elders in the house. I think I spotted Professor Fashuba somewhere there. Thank you very much for being here. You're welcome, sir. Professor Nora Akinola, thank you so much, ma, for being here with us.
Thank you, ma'am.
Professor Yemi Siamusa, we greet you. Thank you so much. Professor Otuyemi, thank you so much for being here, sir. Professor Dia, somewhere in the room, thank you so much for being here.
The great UI.
Professor and Dr. Mrs. Ajite, you're welcome. We welcome all the well-wishers from everywhere. We know that you have traveled from far and wide to celebrate with our delectable matriarch, and we welcome you all.
I show affect because the OAU is known in motorcycles for learning and culture. So Professor Adenike Adeoye fún ìwà tẹwálé ní láti yẹ wọn sí bí wọ́n ṣe ń tẹríba láti jáde kúrò níbi iṣẹ́ lénìí. Ire báyìí kò ní tán láàrin wa o. So we move on quickly to the welcome address by the head of the Department of Ophthalmology, no other person than Professor Benis O. Adegbeyingbe. You are welcome, man. Jam your hands together for her.
Thank you so much. A very good morning and a cool morning. This is really cool this morning. And welcome to every one of us. I want to appreciate our chairperson, Professor Togosun Beckett, for taking up this responsibility of sharing the occasion this morning, and the husband for coming along with her. Thank you for coming, ma'am. The Vice Chancellor of Obafemi Awolowo University, who is not able to be here because of the graduation or convocation ceremony going on in the university currently, but it's presented here by Professor Adeoye Adenike. Yeah, we appreciate you, sir. The acting CMD of the Obafemi Awolowo University Teaching Hospital is not able to be here too because he's in an assignment there in Abuja. And it's represented here this morning by Professor Wato. Good morning, thank you for coming. Our Chief Medical Provost of the College of Health Sciences, Professor Batokwe Kolawole, thank you for coming. My own Dean of the Faculty of Clinical Sciences and the Dean of Deans of the Obafemi University, Ile-Ife. We thank you for coming. The lecturer for today, Professor Charles Obubekibele, we appreciate you for taking your time out to come and give this lecture. My teacher, Dr. Shoeton, and his wife, Professor Mrs. Shoeton, we welcome you, sir, for coming for this program. All the invited guests, I'm sorry that the MC have been talking about medical colleagues, medical professors. I know we have in our midst here a lot of retired professors and current professors from Obafemi Awolowo University. You are all welcome, sirs and mas, and some of them came with their spouses. The members of family of our celebrants today, and the friends, you are all welcome. And our celebrants for today, Professor Mrs. Adenike Adeoye, I thank God for your life. You are welcome to this occasion. It is my great pleasure and I'm very delighted to welcome everybody, and especially our beneficiaries of the just concluded free surgical procedure, surgical outreach. These are people seated on our right-hand side here. and the left of the hall. You are all welcome to this program. This is a special day for all of us in the Department of Ophthalmology. It gives us a great pleasure to celebrate one of our own and the matron of the department, who is the person we are celebrating today. She has been a great teacher, a mentor. Is an icon of ophthalmology who has served humanity in the field of medicine, especially in prevention of avoidable blindness over many decades of her practice as a 5-star ophthalmic surgeon. This is no other person than our adorable, elegant, and amiable matron of ophthalmology, Professor Adenike Adeoye. This day is received with mixed emotion, though we are grateful to God. We would have loved her to continue to be in our midst, but as I mentioned earlier, age is trying to say, go and rest. So, however, we are consoled that she successfully replicated herself in her numerous trainees and mentees. This valedictory lecture is the last in the series of events in honor of this great icon, who has worked relentlessly and nurtured many giants in the field of ophthalmology to maturity, greatness, and excellence. It may please you to know that the Department of Ophthalmology decided to celebrate her because she has been a very good leader, teacher, and mother and sister to many of us. And the valedictory program started some weeks back, precisely on the 12th of October, when the department decided to conduct a free medical outreach, which culminated into free surgeries for some of the people that needed it in our community. And so on the 12th of October, 2022, the department conducted free medical outreach, and then we got 70 people who had cataracts, on which we were able to do free surgical procedures. This was made possible by the members of the Department of Ophthalmology and all our alumni, people that have graduated from the department in time past, who have gone through the training of Professor Adeoye. So at this moment, I want to appreciate all the members, all the doctors in the Department of Ophthalmology, both consultants and resident doctors, and then the alumni of the department all over the country and outside the country. Some people contributed from Europe and America to ensure that we are able to do all that we plan to do in celebration of our matron. So these procedures that we did for you, Master and Sir, was made possible by the contribution from all these people. So, and I'm telling you this morning that some of the beneficiaries of this site restoring cataract surgeries are here in our midst today to honor our retiring professor. And I say a big thank you to all the people who had contributed and support. We have some donors too for this to this program, and we want to acknowledge and appreciate every one of them for this contribution. This series of events is what eventually culminating into a special valedictory lecture titled "Overcoming the Challenge of Cataract Blindness in Nigeria: An Action Plan for Nigerian Ophthalmologists." This will be delivered by an outstanding cataract, anterior segment, and low vision specialist, Professor Charles Obubekibeli, who is from the University College Hospital, Ibadan. Professor Adenike Adeoye is a foundation resident trainee ophthalmologist. He's the first honorary consultant ophthalmologist, professor, and head of department of ophthalmology, both in the Obafemi Awolowo University and the Obafemi University Teaching Hospital, Ile-Ife. And she has given a great contribution to the growth and expansion of the Department of Ophthalmology over the past few years. She is known for, when I say few years, I mean 42 years, so you know how few it is. So she's known for her commitment and dedication to work Our attitude towards work has always been an inspiration for all who went through her in the department. I'm very sure that her values, ethics, character, academic, and clinical skill, which she has imparted, have contributed immensely in shaping the lives and careers of many. On behalf of all of us, I assure you, ma, that we will keep up with the standard and keep the flag flying by God's grace. Even though we are not happy to bid goodbye to you, our dear respected teacher and mentor, we are happy that you will now be able to spend your time for yourself and for your family and friends and concentrate on most hobby which we all know of. On behalf of every member of the department, I would like to say a big thank you for impacting so much on all come along your way, ma. I wish you all the best. I wish you all the best for the next phase of your life. May you have a happy, healthy, and enjoyable retirement with a very long life in joy and more prosperity. I cannot conclude this speech without giving due respect, honor, and appreciation to all the alumni of the Department of Ophthalmology over the past 3 decades and all the doctors in the department. Once again, I say thank you because you have made this valedictory program a huge success through your donations, hard work, and encouragement. We also sincerely appreciate all the members of the family, friends, and associates of our great teachers and mentor, Professor Adenike Adeoye, who gave her the most pleasant support needed for her to be able to pour herself into other people's life. We cannot forget Dr. Eton, who was the foundation consultant ophthalmologist under whose tutelage Professor Adeoye started her career as a trainee ophthalmologist before going to continue her training at UCH Ibadan, and whom I personally benefited from tremendously. On behalf of all of us who still met Dr. Eton in the service of OAU and OAT's Ile-Ife, I say a big thank you, sir, for being a very strong part of our foundation. Our esteemed guests, distinguished ladies and gentlemen, we express our appreciation to the King Eternal, the most powerful and benevolent. We give all glory to God for making this day a great reality and for sparing the life of our mother, who will be returning and celebrating her 70th birthday tomorrow, the 9th of December 2022. Once again, I want to appreciate the former VC, Professor Eyi-Tope Ogunbodede, for taking out time to be here in our midst. When I went to invite him, he told me that he's coming to tell us a story about how Professor Adeoye is going to fly with both wings from Ile-Oluji and from the other town. So I want to welcome us all once again, and I wish all an enjoyable celebration with our mother and a safe return back to your various destinations. Thank you. God bless you.
Thank you very much. Another warm round of applause for Professor Bernice Adegbengbe, the head of Department of Ophthalmology. Thank you very much, ma'am.
There's no better way to celebrate one of us who happens to be one of the members of the first alumni class of the medical school in OAU. Jam your hands together for Professor Odumborayo Adeoye once again. We want to appreciate the following people. Professor Aino, the former Vice Chancellor, Ekiti State University, Ado-Ekiti is in our midst. You are welcome, sir. We appreciate you. Thank you very much, sir. We have one of our own, an erudite surgeon and a father to most of us, Professor Agbakuru. He's also in our midst. Professor Agbakuru, you are welcome. He's always part of this faculty, part of the college, anytime, any day. Representing our Vice Chancellor of the Oba University, Professor Bamire, is Professor Adewale Adegbite from the Department of English. Professor Adewale Adegbite, sir. We are inviting you to the high table. Please come over to the high table, sir.
Thank you.
He's representing the Vice Chancellor.
We also have Professor Mrs. Adejuigbe in the house. You're welcome. Thank you very much for coming, ma'am. Professor Mrs. Komolafe, thank you so much for being here. Dr. Dominic Upong, thank you, sir, for being here. And Professor S.K. Mosaku, thank you so much for being here, sir. And I would like to personally welcome my very own President of the Medical Women Association of Nigeria, Osun State Chapter, Dr. Bridget Omishori. Thank you so much for being here.
Thank you very much. We move on to item number 9, which is reading of the citation of the guest lecturer, and that will be done quickly by Professor Cordially. Jam your hands together for him as he comes to the podium. Thank you, sir.
The chairperson of this glorious occasion, and of course the celebrant of today, please permit me to stand on existing already established protocol as I read the citation of this great man. It's a great privilege to stand before you today to read the citation of Professor Charles Obu-Bekivele. Professor Charles Obu-Bekivele, standing right at the center there, was born in Delta State in early 1960s. He had his basic education in Sapele and secondary education at the Government College, Ughelli, before proceeding to his medical education at the University of Ibadan, where he graduated with an MBBS degree in 1987. They popularly call that the prestigious 1987 set. He had his residency training in ophthalmology at University College Ibadan and obtained fellowship of both the West African College of Surgeons and National Postgraduate Medical College by examination in 1998. He was employed as a lecturer in ophthalmology by the University of Ibadan in November 1999, and he rose through the ranks to become a professor of ophthalmology in October 2010. Professor Bekivele had training opportunities for which he was awarded various certificates and degrees. These include a certificate in intraocular lens microsurgery from Aravind Eye Hospital, India, in September 1998. He went back again to India for a certificate in small incision cataract surgery, Aravind Eye Hospital, October 2007. As if that was not enough again, he went back to India again, certificate in phaco cataract surgery in Aravind Eye Hospital. That was in November 2007. And he eventually went to Lions. He went with Lion WHO low vision certificate in Hong Kong, went to Hong Kong in December 2004. He had Master of Science in Community Eye Health from London School of Tropical Medicine in 2009. He has various distinctions. Because of our time, I want to try and make it an abridged version. He has distinctions, honors, grants, and this includes the Fibasmas Award for the best scientific paper presentation by a trainee ophthalmologist. In actual fact, he was the first winner of that particular award in September 1997. He had the Senate Research Grant for study on recurrent pterygium. He had B.O. Oshintokun Research Grant in 2004 for study on effect of face washing and antiseptic on upper lid bacteria for surgical patients. And had Commonwealth Scholarship Commission in the United Kingdom, DFID, Masters in Community Eye Health in 2008-2009. And he had the British Council for Prevention of Blindness Volta Scholarship, also from Community Eye Health, 2008 and 2009. But Allos Foundation, also Community Eye Health, 2008-2009. He's not just a bookworm. He has also administrative experiences that span through his career. He was Secretary of Ophthalmological Society of Nigeria, OSN, from 2001 to 2004. Professor Bekibele was also Faculty Secretary of the Faculty of Ophthalmology, National Postgraduate Medical College of Nigeria, 2013 to 2016. He's currently the Editor-in-Chief, Nigerian Journal of Ophthalmology. This post he has started holding it since September 2013. He was acting head of Department of Ophthalmology, University of Ibadan from 2007 to 2008. And substantive head of Department of Ophthalmology of Ibadan, Department of Ophthalmology, University of Ibadan, July 2018 to July 31st to 2022. His areas of specialization. Professor Bekibele, primary area of clinical practice and teaching are cataracts, anterior segments, and low vision rehabilitation. So you agree with me that he is the right peg in the right hole for this lecture. However, his interests include ophthalmic epidemiology and blindness prevention. Professor Charles Obu Bekibele is married with lovely children. And in actual fact, he's a proud, oh, no, let us say proud, he's a humble grandfather. Ladies and gentlemen, welcome with me, Professor Charles Obu Bekibele, MBBS, MSc, MD. God bless you, sir.
Thank you very much. The chairman of this occasion, Professor Bikested, the Vice Chancellor of our great institution here, Obafemi Awolowo University, ably represented, various former Vice Chancellors that have been mentioned, Provost College of Medicine, Dean Clinical Sciences, and other deans here present, current professors and retired professors present, doctors, my auntie and great friend, Professor Adenike Adeoye and her family, other guests, especially from Odakeke, her home, other members of the high table, I'm happy to be here. I first met Auntie Nike sometime in 1992, during my first year as a junior resident in ophthalmology, UCH. She had then come back to UCH to prepare for her part 2, that's her final exams in ophthalmology. I was a young resident and she took me along as a mentee then. Along with her, we had other senior registrars, Dr. Luyadi, Dr. Ajibode, Dr. Adioti. And I was particularly drawn her calm disposition. And she took me as like a younger brother, and she showed me the ropes in ophthalmology. And this relationship continued even after she left UCH, to come back to OAU Teaching Hospital when she had finished. But it continued, and she invited me to co-supervise many residents, and the result of that was that we published several papers, several publications of great repute that have been published in many journals. And again, in the year 2015, she was elected as chairman of the Faculty of Ophthalmology of the National Postgraduate Medical College. Then I was secretary. So I was a secretary then. I was a secretary for 2 years. And again, I learned a lot under her tutelage, especially with regards to administration. She showed herself to be an excellent leader and an astute administrator. I'm therefore eternally grateful to her for her sisterly love and guidance over the years. And of course, I consider it a great privilege to have been invited to give the valedictory lecture on the occasion of her retirement from active public service. It was therefore with great joy that I accepted the request, and I wish her happy retirement in good health of mind and body. Congratulations, Adenike. About blindness, and especially cataract blindness in Nigeria, is a big problem. Well, first of all, I need to explain what blindness is and what visual impairment is. So the lay person will think blindness is somebody who just can't move around, but it's more than that. It starts even before the person is unable to move around. There are stages in visual impairment where a person is not able to function maximally to their capacity to be able to carry out activities that they need to be able to lead a good existence. However, from ophthalmological point of view, the International Classification of Diseases, ICD-11, in 2018, classified visual impairment into 2 groups, both for distance and for near vision. And distant visual impairment refers to, there are 3 grades: mild, in which the visual acuity is what we measure when we want to determine the degree of visual impairment somebody has, how much the person is able to see from afar. And we have a way of measuring it. And when somebody has a visual acuity of less than 612 to 618, we say the person has mild visual impairment. And when the visual acuity is worse than 618 to 660, we say the person has moderate visual impairment. And when it is worse than 660 to 3/60, we say the person has severe visual impairment. And these imply that the person is impaired and not able to function effectively with activities that they would normally want to be able to do. Blindness, on the other hand, is when visual acuity is worse than 3/60 in the better eye. That is when the person is not able to count your fingers when you are about 3 meters away from the person. That is what we consider as blindness. And then again, we also have near visual impairment. And this is when the person is not able to read prints that are designated as N6 from about 40 centimeters. Now, the magnitude of cataract blindness and visual impairment in Nigeria is much, like I said earlier on. But globally, about 2.2 billion people have distance or near visual impairment. That's a large number. However, 94 million out of this number have blindness or visual impairment due to cataract. So cataract is a big cause, it's a major cause of visual impairment and blindness. Again, what is cataract? Cataract is the opacification of the lens. Like virtually everybody has a telephone, especially an Android phone, that has a camera. The camera that God put in our eyes is called the lens. And if it remains transparent and clear, then light can pass through and then we can perceive what we look at. But when that lens becomes opacified, becomes stained to look white, then we say the person has cataract. And a major cause of blindness and visual impairment, both globally in Nigeria, is due to cataract. A survey in Nigeria between 2005 and 2007 reported that for all ages, about 0.78% had blindness. And an additional three times this number had visual impairment. And cataract accounted for about a half of this number in Nigeria. And so if we calculate from that, we can say that the current estimate of number of persons blind or visually impaired from cataract in Nigeria is about 2.92 million people. So almost 3 million people are either blind or visually impaired from cataract in Nigeria. Cataract increases in number with age. So as we get older, the likelihood that we get cataract is very high. It also increases in where we stay, especially those who live in tropical areas where there's a lot of sunlight. Again, we are very prone to developing cataract. And another important cause is systemic diseases like diabetes. Diabetes is becoming a major problem due to change in lifestyle among our people. So we are becoming prone to diabetes, and that increases the risk of cataract as well. Now, the prevalence of cataract worldwide is essentially universal. It's present globally. Every part of the world has cataract. But the impact is more felt in middle and low-income countries, especially those of sub-Saharan Africa. And the main reason for this is because of a low surgical rates, as well as a few other issues like poor literacy rates, poverty, and sunlight, like I mentioned earlier on. And again, our aging population is increasing. Our people are getting to live to old age more than it used to be like 20 years ago. So prevalence of cataract in Nigeria and other sub-Saharan Africa is increasing, as shown by this, by the figure. The figure shows distribution of cataract, and we can see that and even some parts of Europe. How do we overcome the challenge of cataract in Nigeria? Are we doing enough surgeries? To answer this question, we undertook a surgery. Now, the cataract surgical rate is the number of cataract surgeries that are performed per million population per year. It is a measure of the quantity of cataract services available in a country, and it varies between countries, and there's a correlation between gross domestic product and the cataract surgical rate. Our gross domestic product is very low because our poverty rate is very high. So our gross domestic product is very low. Rich countries, such as those in America and Europe, have very high have higher rates, have higher cataract rates, surgical rates than those in sub-Saharan Africa, as shown by the next figure. And that's figure 2. The cataract surgical rates by regions of countries globally shows that the rates are higher in well-developed countries like Japan, Australia, and the USA, followed by Europe, places like Hungary, Bulgaria. But in Africa, the rates are very low. And Nigeria has a rate of 307, compared to more advanced countries. Compared to the USA, for example, our cataract surgical rate is 317, while that's for USA is 6,353. And for India, 4,830 cataract surgeries per million population per year. So comparing 300 to 4,000, it's a really big gap. That means there's no way we can do enough cataract surgeries at the current rate we are going. Remember, I said we have about 3 million cataract cases, and we are only doing 300 per year, per million for every million population. So that is not enough. The reason for these low rates are many, but various studies have shown that cost of surgery, poor access to where surgery is done, gender disparity with females not having adequate access, partly because of low income and family barriers, as well as fear of outcome, are things that have been found to be responsible. Now, our survey that we carried out between September 16 and October 15 looked at trying to identify what is responsible for our low cataract surgical rates and what we can do to improve the situation. And the aim was to develop an action plan for Nigerian ophthalmologists to help overcome the challenge of low cataract surgical rates. And this lecture presents the finding from that survey. It was an online survey carried out using Google Forms between September and October, like I said, and 500 telephone numbers from Ophthalmological Society of Nigeria WhatsApp platform and 400 email addresses of members obtained from the OSN Secretariat were used to communicate with all grades of ophthalmologists in Nigeria. That includes consultants, diplomates, and residents, all practicing in Nigeria. They were advised to fill the forms only once. And despite repeated reminders, only 201 out of the over 400 potential participants returned the filled forms. The returned forms were entered into an SPSS data entry sheet and subsequently analyzed. The results showed that the 55.7% were females, 68.7% were consultant ophthalmologists, 29.3% were resident ophthalmologists in training. The average age was, the age range was 28 to 71 years, and years of practice ranged from 1 to 42 years. The hospital of practice for the respondents, majority were from teaching hospitals, 64.5%, then 16 from federal medical centers through government tertiary hospitals, and mission hospitals accounted for 4%. There was even distribution with all geographical zones of Nigeria providing adequate coverage, but majority were from the Southwest with 36.8%, 21.9% in the Northwest. Least represented zone was the Northeast. Location of practice, majority lived in urban areas, that's 82.6%, while 16.4% lived in semi-urban areas. Only 1% were rural in location. That's the ophthalmologist. Now, looking at cataract surgery-related activities, the number of ophthalmologists performing regular cataract surgery in each hospital ranged from 0 to 40, with a mean of 9.23. The number of cataract surgeries done by each hospital per month ranged from 0 to 600, with a mean of 46.62. Most common type of surgery performed was M6, that's manual small incision cataract surgery. Phaco emulsification was done by just 1.5, and ECC, that is extracapsular cataract extraction, performed in just 4.5%. The visual outcome of surgeries done, majority of respondents reported that over 50% of their patients had post-operative visual acuity of 618 or better. That is majority, that's more than 50%, more than half of their patients had good visual outcome. The average number of cataract operations per surgeon per month was 11.29, plus or minus 14.9, with a range of 0 to 120. Majority or 90% of respondents were not happy with the number of cataract operations they were doing every month and would like to do more cataract surgeries. And for ease of analysis, the number of cataract operations per hospital every month was regrouped into hospitals with less than 20 cataract surgeries, those of between 20 to 49, and those of over 50 surgeries per month. And then looking at outreach activities, the sources of patients for cataract surgery had various combination of sources, with regular eye clinic patients, referrals, and outreach activity accounting for highest proportion with 42.2%. The hospitals doing outreaches, about 75% of hospitals were doing outreaches, leaving 25% not doing outreaches. And the greatest proportion of outreaches were those with community invitation or community sponsorship. And there were two main types of outreaches. Outreaches where the doctors just go to the community and screen for cataract and then take the patients back to the main hospital. That's the main hospital to do surgeries. That was one group. And then the other type of outreach where the doctors go to the community, harvest the cataract, and there and then do the surgeries within the community. And most camps were just screening camps, while about 44.7% were both screening and cataract operation camps. Now, number of outreaches per month range from 0 to 200, with a mean of 6.52. And the number of cataracts seen per outreach ranged from 0 to 360, with a mean of 35.95. Only 23% of hospitals where respondents practice, that is less than a quarter of hospitals where respondents practice, were able to operate more than 90% of outreach cataract patients seen monthly. That means that a large proportion of the harvested patients were not operated within the month. Now, good community participation in outreach is reported by majority of respondents, while good hospital support was also reported by majority of the respondents. And then we looked at the effect of hospital type on the number of monthly cataract operations. And we saw that mission hospitals had more high volume performance than other groups. So compared to the teaching hospitals, the government hospitals, the mission hospitals seem to be doing more cataract surgeries than the others, as shown by the figure, okay? We see that a greater proportion of mission hospitals were doing high volume surgery, more than 50 cataracts per month compared to the other groups. And then effect of camp surgery on proportion of camp cataracts operated. That is the effects of doing the operations at very close to where the patients lived. We found that this had a profound effect on improving yield as well. So 57.9% of screening camps did over 50% of cataracts operated, as compared to 73.2% of screening plus cataract camps, cataract surgery camps that did over 50% of their cataracts that they harvested. And then we also examined the relationship between post-operative vision better than 618 on surgical volume. This did not really show any impact on the number of cataract surgeries done. Now, regarding barriers that were identified by the respondents, the most important barriers accounting for low surgical volume reported by the respondents were high cost of surgery by close to a quarter of the respondents, inadequate infrastructure and instruments in the hospitals, lack of skilled or trained personnel. And the least reported barriers were effects of insecurity in the country and some patients feeling that they were too busy to come for surgery. And the 10 most prominent barriers identified were cost, lack of personnel and adequate training, poor access to areas of service delivery, fear of outcome by the patients, ignorance of patients about the needs for surgery, or beliefs about possible cause of poor vision and blindness, and then poor infrastructure in the hospitals, bureaucratic process in teaching hospitals, and poor attitude of staff, and then lack of adequate theater space and adequate theater time, lack of consumables for surgery, and presence of comorbidities in patients like uncontrolled diabetes and uncontrolled hypertension. So those were the 10 prominent, most important barriers that affected surgery, affected patients coming for surgery. And then the interventions that were recommended to overcome these barriers include reduce cost or provide subsidized surgery for our patients, to carry out adequate advocacy with government or hospital management and community stakeholders, as well as community education, the use of counseling service and motivators within the community. And of course, the 10 most important interventions that were recommended included cost reduction, advocacy, health education, carrying out regular outreaches to the communities, provision of adequate infrastructure, manpower development, changing attitude of staff to patients, training and retraining of members of staff, and a need to reorganize theaters in centers. Now, if we remember that 90% of all ophthalmologists in Nigeria felt that they were not doing enough surgeries, and the recommendations to improve their rate of doing surgeries include outreach enhancement with facilities for camp surgery, because we noted that doing surgery at camp, close to camp, screening camp, enhanced the rate of harvest. So they recommended that, or carrying out external surgery outlets. That is having a kind of MOU between teaching hospitals and other state hospitals or other smaller hospitals that have less barrier with regards to fear of imposing infrastructure and things like that, so that patients may find, the community patients may find it easier to go to such hospitals. And then with an MOU between the doctors in teaching hospitals, going to such places to do surgery closer to the community, they'll be able to harvest more. And then cost reduction with use of philanthropic donors, infrastructural development, providing essential equipment and consumables provision, training and retraining of surgeon and support staff. Again, 10 important interventions to improve harvest by surgeons to improve the number of cases they are doing includes, as shown on the figure there, and include enhancing outreach, cost reduction, infrastructural development, training and retraining, social marketing, theater reorganization, providing friendly hospital, make the hospitals more friendly to patients. Now that, you know, the center of attraction in the hospital is the patient. So everything should be made possible to attract the patient there through social marketing principles. Friendly health insurance, and also providing for staff welfare. A lot of doctors are immigrating out because of poor welfare. So it would be nice to improve their welfare so that healthcare workers will not emigrate out. Otherwise, the time will come, we may not even have enough hands to do the job. So observations from this survey. The survey had a good spread among practicing Nigerian ophthalmologists, as shown by responses from all geographical zones of the country, representation from all cadres of ophthalmologists, good representation of hospital groups providing care and training. The number of monthly surgeries performed in our hospitals differ significantly between our hospitals, ranging from 600 cataract surgeries for various reasons. But noteworthy was that majority of hospitals do M6 as their main cataract surgery procedure, thus ensuring better post-operative outcome compared to doing ECC. And also over 90% of respondents reported not being happy with the number of cataract surgeries they do every month and would like to do more. Thus, the workers are willing, but cataract harvest has been limited by barriers and circumstances surrounding the process of cataract harvest. A quarter of the respondents reported that their hospital were not doing outreaches. This is a setback since outreaches provide a good reservoir of cataracts for hospitals. 3/4 of respondents reported their hospitals are doing outreaches, and a greater cataract surgical yield was achieved by those who combine screening with surgery for cataract patients close to the location of the outreach within the community. Doing surgeries close to the home of patients remove the effect of barriers such as transportation and poor access to base hospitals. As much as possible, outreaches should be done with the cooperation and support of the community, thus ensuring community mobilization and sponsorship of surgery to the indigent population within the community. Mission hospitals did more high-volume cataract operations than other hospital types. Mission hospitals are usually not subjected to bureaucracy of civil service and attitude issues of the staff of government hospitals. They are also least likely to be affected by industrial action by various cadres of staff. The private hospitals were the least performance in terms of surgical volume, possibly related to high cost of surgery in private practice. The major barriers to surgery identified from this survey were high cost, inadequate infrastructure, as well as lack of skilled and trained manpower. Shaheen Abubakar and Paul Cartwright also found cost, direct and indirect, as the most important commonly reported barrier by RAB surveys in Africa. Not surprising that our survey of a cross-section of Nigerian ophthalmologists considered cost as a significant barrier. Wages are low in Nigeria, and the country has been described as the poverty capital of the world, with GDP per capita of $2,422 as compared to more advanced economies such as the United Kingdom with a GDP per capita of $46,209. The relationship between GDP and low cataract surgical rate is well documented. Thus, the need for interventions directed at reducing costs of surgery to the patient through health insurance, sponsorship by philanthropists, or waiver scheme from hospital or government. Other important barriers, such as poor infrastructural support, reveal the need for advocacy with stakeholders to ensure provision and maintenance of relevant infrastructure, equipment, and surgical instruments. Lack of skilled manpower, including surgeons and support staff, calls for setting up of an ongoing training program for training and retraining update programs for skill enhancement in new techniques for cataract surgery as they evolve. Other important interventions highlighted by respondents include outreach enhancement and incorporating a surgical camp into hospital outreach programs would reduce effects of poor access and unfriendly hospital environment as barriers to rural patients. Resident doctors also need to be given more opportunities to operate so they can build their confidence and improve their skills. Theaters in government hospitals need reorganization of time and space usage so as to increase their efficiency. This ensures surgeons are able to do more within available time allocation. Regular monitoring and evaluation of cataract surgery outcomes of ophthalmic units through cataract surgery audit. This will drive the need for regular training and retraining of personnel. So, recommendations. Short-term plans. Every ophthalmic unit, department, or hospital must provide a functional outreach unit headed by a consultant ophthalmologist with interest and training in community eye care. The outreach team composition to include public health nurses, an administrative camp organizer, counselor, resident doctors, and health assistants. They are to identify potential screening and surgical campsites, outreach activities several days within the week. Eye units stroke departments must carry out serious advocacy with hospital management to ensure provision and maintenance of essential infrastructure, equipment, surgical instruments, and consumables. Also, advocacy for price reduction, advocacy for community stakeholders to sponsor indigent patients for cataract surgery. Ophthalmic departments to reorganize theater for adequate and efficient use of time and space. Surgeries, cataract surgeries need to be commenced on time. 8 a.m. should be 8 a.m. 8 a.m. shouldn't be 10 a.m. We need to start on time, and you can have 2 batches of surgeries in a day, morning batch and afternoon batch. Units can have morning and afternoon surgical sessions daily. Surgery time should be scheduled to ensure all surgeons get enough operating time and ensure residents get enough exposure. Enforce a policy where a table is left for residents and another table for the supervising consultant. Develop a formal training and retraining hands-on program for surgeons and nurses and provide a good functional wet lab. Maintain an online surgical record system, a spreadsheet. This will enhance monitoring and evaluation of surgical audits, which can be presented in the department quarterly. And long-term plan. The Ophthalmological Society of Nigeria must act as a pressure group along with NGOs, non-governmental organizations, such as the CBM, that's Christopher Blinded Mission, and Sight Savers International, to encourage the Nigerian government to expand the National Health Insurance Scheme to cover all Nigerians, that is to have a universal coverage with adequate eye care insurance coverage. That's a long-term plan. So in conclusion, in order to overcome the challenge of cataract blindness in Nigeria, a lot needs to be done by all stakeholders to ensure that no one is left needlessly blind from cataracts. Acknowledgement. I appreciate the contributions of Dr. Toke Ayorinde and Professor Valedictory Olusoya. Ayorinde helped to fine-tune the study questionnaire, while Professor Olusoya designed the Google form, analyzed the survey responses, and edited the manuscript. I thank you all for your attention.
Ladies and gentlemen, please let's rise to our feet as we give an ovation to our guest lecturer for that erudite lecture. Thank you so much, sir. We can have our seats, ladies and gentlemen. Thank you very much. Indeed, we are grateful for that lecture. Quite eye-opening, if you would allow me to say. Very quickly, we go on with the program. Please allow me to welcome a few more guests that came in during the course of the lecture. Very quickly, I would like to welcome into our midst Mrs. Osehare, who is representing the registrar of Obafemi Awolowo University. You're welcome, ma'am. Thank you so much for coming. We have with us today a beautiful, colorful array of world-renowned ophthalmologists. Please welcome with me Professor Adeoye Adenike, a retiree ophthalmologist from UCH, who is also a trainer and a personal friend to the celebrant. Thank you so much for coming, ma. We also have Professor Folashade Akinshola from LUTH, Lagos. Thank you so much for coming in, ma. We welcome you. Allow me to recognize Dr. Yomi Okunwola, the MD Kano ATHC chairperson in the house. Thank you for coming. Also, Dr. Inyade Ijadunla, a former M1 Osun State president. I know she's sitting somewhere in the corner there. Thank you very much for coming. We have in the house also Professor Oti Afolabi. Thank you for coming. Professor T.A. Badmos, Professor Ndububa, Professor Onipede, Professor Ezei, and then Professor Onoyade, Director, Institute of Public Health. Thank you so much for coming, sir. Thank you. We also have Professor Kemi Rotimi in the room. Thank you so much for coming, sir. It's a pleasure to see you. So we've come to the time when we appreciate the celebrant and we pay tribute. And I know that when we get to a time like that, it becomes Tabania Kareolua. So we don't want Ile to show more. Let's get it straight, okay? We don't want that. So we're going to keep it succinct, we're going to keep it short and sharp. But allow me to start by saying, every single person in this room will agree with me that Professor Adeoye has this regal hair around her. Isn't that so? In the way she talks, in the way she walks, in her professionalism, in everything she does, that excellence shines through. It's always a pleasure to recognize and appreciate you, ma. Congratulations. God bless you. To start off with the appreciation, I would like to welcome a representative of the beneficiaries of the free cataract surgery program. Please welcome with me to the podium, Pastor Peter Ilori. A round of applause for him, ladies and gentlemen.
Good afternoon, sirs, and good afternoon, Mama. I'm representing the beneficiaries. I would like to speak in Yoruba because the majority of us here are very old, not educated too, in the formal way. Mama àti Daddy, ẹ jókòó, ẹ fetí sílẹ̀ sí mi o. Ẹ jọ̀ọ́ àwa tá ń pín oúnjẹ yẹn, ẹ jọ̀ọ́ ẹ dúró díẹ̀, please, ẹ jọ̀ọ́. Torí pé ohun tí a rí gbà lọ́wọ́ wọn kò yẹ kí oúnjẹ kó má jẹ́ ká mọ orí tá fẹ́ fi hàn. Mo dúró mo ń sọ̀rọ̀ lórúkọ àwa tí a jẹ àǹfààní ohun tẹ́ gbé sílẹ̀ fún iṣẹ́ abẹ ojú fún àwa tí a ní àrùn kan nínú ojú wa. Àwọn dókítà ló mọ irú àrùn tó ń bẹ ńbẹ̀, ó lè jẹ́ cataract, ó lè bá jẹ́ cataract. Ṣùgbọ́n à ń fi ìmoore à ń fi hàn torí pé tí ẹ bá gbé ìgbésẹ̀ yìí, irú èmi gan mi ò ní síbí lénìí. A dúpẹ́ lọ́wọ́ yín o lọ́pọ̀lọpọ̀ torí pé ọ̀pọ̀lọpọ̀ wa a lówó láti ṣe nǹkan tí ẹ fún wa ẹ̀. Ọ̀pọ̀lọpọ̀ bá lówó ni wọ́n á ti ṣe tipẹ́tipẹ́. Àwa tá tiẹ̀ lówó gan náà bóyá tá lówó láti ṣe. Ẹ tún fún wa láǹfààní láti pé ká lówó wa fún nǹkan míì. Ẹ ràn wá lọ́wọ́ lọ́pọ̀lọpọ̀. Màá fẹ́ kí àwọn dádì àti mọ́mì ká dìde dúró. Gbogbo àwa tí a jẹ àǹfààní látọ̀dọ̀ mọ́mì ẹ jẹ́ á dìde dúró. Bó ti wù kí ibikíbi tá a bá wà ẹ jẹ́ á dìde dúró. Ẹ jẹ́ á dúpẹ́ lọ́wọ́ pé màmá ẹ ṣé o. Màmá ẹ ṣé o, ẹ ṣé o. Amen. Ẹ jẹ́ á jókòó. Being a pastor, ẹ jọ̀ọ́ ẹ fún mi ní opportunity láti gbàdúrà fún màmá. Ẹ jẹ́ ká díjú ẹ jọ̀ọ́. Bàbá wa àti Ọlọ́run wa ọba tó pọ̀ ní pàtì agbára. Ẹ ṣé lọ́pọ̀lọpọ̀ fún àǹfààní tẹ́ fún wa lénìí. A yìn orúkọ yín lógo fún ọmọ yín tí wọ́n ti fi àkókò wọn sílẹ̀ tó ń ṣiṣẹ́. Wọ́n ṣiṣẹ́ fún ìjọba, wọ́n lo gbogbo agbára wọn, wọ́n lo okun wọn. Mo ń go through nǹkan tí wọ́n kọ, àwọn kankan tí wọ́n kọ síbí, mo rí wípé àwọn kan mi lè tún wà o. Ṣùgbọ́n kan méjì lèmi dì mú bẹ́ẹ̀. Láti kékeré wọn wọ́n mọ Ọlọ́run, wọ́n mọ Jésù. Wọ́n wà ń kwaya. Àwọn lè má mọ̀ pé àwọn kan wọ̀nyí lè má ṣiṣẹ́ fún wọn. Ṣùgbọ́n they are so germane to our success. Mo rí wípé Ọlọ́run ó ràn wọ́n lọ́wọ́ lọ́pọ̀lọpọ̀. Wọ́n ṣì ayé wọn lò, wọ́n ṣì gbà wọn lò. Àsìkò tí Ọlọ́run fún wọn àti opportunities tí Ọlọ́run fún wọn, wọ́n ṣì lò. Ayérayé Olúwa gba ọpẹ́ wa. Ìwọ lọlọ́run tó fún wọn ní ọmọ, wọ́n sì ṣàṣeyọrí lórí wọn. Lẹ́nu iṣẹ́ wọn gba ìwé lọ gbélé ẹ, wọn rí jàǹbá kankan. Òun náà làwọn náà fi lè wà bílẹ̀ láti pé ká jẹ́ alábàápín nínú oore tẹ́ ẹ ṣe fún wọn. Ayérayé Olúwa gba ọpẹ́ wa. Màmá mo gbàdúrà fún yín. Ẹ̀yin náà ti ń lọ sípò àgbà. Mo gbàdúrà àgbà yóò ṣẹ́dà fún yín lórúkọ Jésù. Ẹ ní fàìsàn ló gbà ọ́. Àwọn tí wọ́n máa ń bí nínú ayé lórúkọ Jésù ẹ ní pàdé wọn. Ẹ ti yanjú fún mọ̀lẹ́bí yín. Àwọn ọmọ tẹ́ bí náà wọ́n ò yanjú lórúkọ Jésù. Ẹ̀mí tí ń kẹ́kọ̀ọ́ lára yín kó wọnú ayé wọn lọ. Ẹ̀mí tí mọ̀ pé Ọlọ́run ló ń ràn yàn lọ́wọ́ pẹ̀lú ìwà gidi. Ìwà certificate lọ́pọ̀lọpọ̀ a máa ń lé ìwà dànù. Gbogbo ilé tí màmá tí wọ́n ṣe láṣeyọrí lé ní mo rí pé ìwà wà ń bẹ láti kó èèyàn jọ, láti mú àwọn tó jù wọ́n lọ, àwọn tó ti ṣáájú wọn, wọ́n tún pè wọ́n padà pé ẹ wá bá mi yọ̀. Gbogbo wọn sì ìwà ni. Kì í ṣe certificate kọ́. Afogo forúkọ yín torí pé ẹ ṣìwàwò. Gbogbo àdúrà gbogbo ilé tó kù nínú ayé ẹ ní ṣìwàwò. Ọba yóò ràn yín lọ́wọ́. Gbogbo àwọn tẹ́ ẹ ti lò, ó pọ̀ lọ́jọ́ tí wọ́n ṣe surgery fún wa. Màmá gan bọ́ aṣọ sílẹ̀ ni wọ́n wọ aṣọ iṣẹ́. Àwọn ọmọọṣẹ́ wọn náà wọ́n ṣiṣẹ́. Bàbá ìwọ tó ṣe léyìí fún bàbá Olúwa mi dì wọ́n mú o. Gbogbo àwọn tí wọ́n bá wọn ṣiṣẹ́ mo ní Olúwa dì wọ́n mú. Màmá gúnlẹ̀ láyọ̀, ẹ̀yin náà ẹ gúnlẹ̀ láyọ̀ o. Màmá lẹ́ẹ̀kan sí mo gbàdúrà fún yín lórúkọ Jésù, ẹ ní kú lójijì o. Ẹ dàgbà sí, ẹ darúgbó, á sì yin Ọlọ́run lógo. Ògo ni fún orúkọ Olúwa. Gbogbo àwa tá a wá síbí àtàwọn tí wọ́n fìwé pè àti wá láyọ̀ á padà sílé láyọ̀. Ògo ni fún orúkọ Olúwa. Jésù Olúwa wa. Àmín, àmín, àmín lórúkọ.
Thank you very much. Thank you. Thank you. A round of applause for the representative of the beneficiaries of the free cataract surgery. Thank you so much. Amen to all the prayers. And now, going on, please allow me to welcome into our midst Professor Adeoye is in the room somewhere. Thank you for coming. You're welcome, sir. And let me also welcome colleagues from Uni Osun who have come to celebrate with the celebrants, Professor Ishaumi and Dr. Hassan. You're welcome. Thank you so much for coming. Going on now, I would like to hand over to our chief hosts for their tributes. Please allow me to call on the Vice Chancellor, ably represented by Dr. Adebite. Please welcome him to the... Professor Adebite.
Thank you. Thank you very much, ladies and gentlemen. The protocol is already well established, but permit me to still appreciate one or two people. The chairman of the occasion, there, Mama Big Estate and the husband. Thank you very much. When I was doing my inaugural in 2010, the VC wasn't at home, and she was Deputy Vice Chancellor Academics. So definitely she stood in, and that remains unforgettable to me. Thank you, Mama. Celebrant of today, Mama Adeoye. Congratulations. Congratulations. Well, when ẹni tó bá ń ṣe iṣẹ́ Olúwa, Olúwa máa gbọ́ tiẹ̀ náà, iṣẹ́ rere yín tọ̀ yín lẹ́yìn. Ọlọ́run ò ní fi yín sílẹ̀. Today is a happy day for you. Ayé yín kalẹ̀ o. Professor Shoetan, I'm glad that you are here also with your husband. And we work together on a particular panel. Before I go to my speech, let me appreciate the lecturer of today. You are welcome, sir. That was a very beautiful one. The kind of lecture that we expect on this occasion. It's take home. It's take home. It's not limited to only you in that field. That is take home for everybody. Please keep it. I don't have a cataract, I don't have it, but I know I've gained a little to also, as an academic, advise people. Thank you very much, sir. I'm glad to be here again today to represent the Vice Chancellor of the university. Of course, we all know what is happening today. It's only someone like Mama Adeoye that can pull a crowd here today, even when the convocation is going on. Please, let's clap for her. And you know, when the university is having a convocation ceremony, you see the inner circle. Everybody is there. Whether the DVC, whether the registrar, whether everybody is there. And so the VC has to look for someone to represent him. And definitely, out of the way is College of Medicine, because you are all participants. So none of you can be here to represent the Vice Chancellor. So he has to look outside. And when he looks outside, he wants to look at someone that looks like him. In stature, you can see. Those of you who don't know the VC will even think I'm the VC. And they said, because I'm an usher in an Anglican church, it's only on Sunday that I wear suit too. But I want to look like the Vice Chancellor. That is why you see me wearing suit today. So I appreciate the past Vice Chancellors who are here today, all provosts, all elder statesmen. Please, in 1 minute, all elder statespersons, if you don't mind, to stand up. What I mean by state person is someone who is retired and is here now. Can we please stand up for a few seconds? Anyone who is retired but is here now, please clap for yourselves. Thank you very much. Please have your seat. You are all appreciated. That shows that you are very relevant and that you appreciate our celebrant for today. Thank you. One other reason why I think the VC has called me to represent him here today is that, of course, I'm older than the Vice Chancellor, and I'm closer in age to the celebrant of today. So maybe I should come here also to come and learn some experience about what is happening. So thank you for giving me that opportunity. Well, Professor Mrs. Adeoye, one or two things about her. By the grace of God, we both serve on a committee in the university, the Anti-Corruption and Transparency Unit. And you know what we mean by anti-corruption and transparency. That says a lot. It says a lot of the type of person that she is. You know, that is not a committee for just anybody. And even though I am the chairman of that committee, I met her there. They were the foundation members. So, can we please appreciate her for that? So, having said that, the advice that I would like to give to you already is demonstrated here. I'm quite happy, especially to have been called to speak after the last speaker, who has demonstrated really the propensity for charity by our honoree, our hostess of today. Thank you very much. That is what I want you to continue to do. This is the time for it. We want you to do more charity. We know the few professions that really work for God. In the church, we know. In hospitals, we know. And we teachers. And perhaps agriculturists. These are the people that are closer to God. Now, please continue with the charity work, ma. May God continue to bless you. May you continue to reap the good fruits of your labor. Thank you very much, ladies and gentlemen.
Thank you very much, sir. The Vice Chancellor, ably represented by Professor Adegbite. Thank you, sir. Please allow me to welcome very quickly to the podium the representative of our Chief Medical Director. Please welcome with me, Dr. Nwato. A round of applause for him, please, ladies and gentlemen.
She has told me it's just for a few minutes, so I'll be as brief as I can. I stand to represent the acting CMD of the Obafemi Awolowo University Teaching Hospital. I bring a special message because the celebrant today is somebody who I really have not had very close contact with. But what I remember about her so much is this person that is always smiling, calm, calculated. And her involvement strikes me so much as somebody that is really involved. Because I know I saw some people in front of the dental hospital and some weeks ago, they came to share some things about cervical screening and the rest of them. And to my surprise, she was part of the team. And I could imagine that somebody that is retiring at 70 could still walk that length, that distance, going from one part of the teaching hospital to the other.
along with other people. So I'm not surprised that they say we have a very young, retiring professor. I think we should clap for her for that achievement. Well, old age is a relative thing, and it is not something that we should dread. Research has shown that not everything goes bad with age. In fact, current research shows us that there are many aspects of our brain that get better with age. One of those areas is the ability to separate the chaff from the correct things. That's why you might be surprised. As young people, that's why we run to the old men. And maybe as a young head of department, you think everything is coming down. And when you spend just 2 minutes with an older person, say, oh, I didn't know it was as simple as that. You smile and go out. That's one of the things about getting older. There's the self-control is much better. I mean, and the ability to absorb new information and even to adapt. People think old people don't change, but science has shown that old people have a better chance to adapt. I'm not referring to her. She's still young. Yes, when I say old people, I mean, I'm talking about 20, 30, 40 years from now, because she's just entering that age. And in fact, even the capacity of the brain starts functioning much, much better around 60, 70. So unfortunately, by the time you are retiring, that seems to be the most productive part of your life. This is science. It's there for you to see. So we want to congratulate her for retiring today. And I will say something which probably she might not know I'm aware of. She's very much respected by her colleagues. And I'm also aware that a few years ago, she was even approached that, Mama, please come and become the provost. They say, how did this man know that? Yes. Good things go around, bad things go around. But it's good we celebrate our people while they are still alive. And she declined. They said, sorry, you don't even need to contest. They said, sorry, I don't want. That shows how much respect they have for this brilliant, beautiful, godly young lady retiring at 70. Let's clap for her. Thank you very much.
Thank you very much for that tribute. Please let me quickly welcome to the podium for his tribute, the one and only Provost, College of Health Sciences, Professor Babasope Kolawole. Please welcome him to the podium with me.
The chair of today's event, Professor Mrs. Dikestet, Vice Chancellor, OAU, here represented by Professor Adeoye, past and current Vice Chancellors seated. Permit me to then stand on the already established protocol. I've already written my tributes in the program booklet, so I will just be reading from there. On behalf of the leadership, staff, and students of the College of Health Sciences, where Professor Mrs. Adeoye spent the better part of our working life, we greatly rejoice with you today, Ma, on the occasion of your 70th birthday, which I understand is coming up tomorrow, really. So we congratulate you all the same, as well as your retirement from the services of the university and that of the teaching hospital. Prof joined the university as lecturer 1 on the 18th of November, 1994, after successfully and may also add meritoriously completing a residency training in ophthalmology. By dint of courage, hard work, resilience, and every other adjective you can imagine, she rose to the position of professor on the 1st of October, 2010. In fact, while reading through this book today, I gained more insight from what Mommy Amire wrote about the years of the residency years, the years of laboring as a mother, as a researcher, as everything. Prof just combined everything in one. and we can see the outcome today. I think it's also appropriate at this point to just celebrate Professor Adeoye again. Let's give her a round of applause. Professor Adeoye can be regarded as the matriarch of ophthalmology in Ife. She taught and contributed to the training of generations of medical and dental practitioners, passing through the teaching hospital as well as the university. Several of her mentees are now professors themselves, who have also gone on to pioneer eye care training centers around the nation. Also of note is her demonstrable commitment to her alma mater, the College of Health Sciences, Obafemi Awolowo University, where she has served on several committees, both in the college and in the university. She remains a regular financier of alumni projects in the college, and I think she deserves a round of applause for that. Mommy Adeoye is one of the few people we run to when we run into needs and challenges, and she's always available and willing to come to our aid. She's dogged in her quest to see the college maintain her enviable position in the ranking of healthcare training institutions globally. And she was, for this and many other reasons, conferred with the Distinguished Award of Distinguished Alumni at the 2014 Annual Grillo Lecture. Professor Adeoye is leaving behind an indelible record of dedicated service to the college, university, and humanity. And this has already been alluded to today when the beneficiaries of our program spoke. She performed the first successful extracapsular cataract extraction with posterior chamber intraocular lens implantation at the University Teaching Hospital as far back as 1999. She was also instrumental to the establishment of the eye care unit at Wesley Guild Hospital, Ile-Ife. We pray that Mama will live long to enjoy the fruits of our labor. I will have ended, if I ended my talk here, it will be incomplete if I don't say and emphasize that Professor Mr. Adeoye was a member of the very first set of doctors that graduated from our College of Health Sciences. And this was in 1978. This year, 2022, marks the 50th year of the commencement of health professions training in our university here. And all through the year, we've been having events. We had the flag off event in March, and the grand finale will be coming up next Wednesday, December 14. So as many of you as have come to rejoice in Mama today, please come and also celebrate her next week, Wednesday, at the 50th anniversary lecture, which will be delivered by no one else than Professor Yitokwe Okumayede, college historian. Prof has put together a compendium of the story of our college, and we're going to be launching that in book form come next Wednesday. Prof, I remember at the flag off event, we were discussing, and we were looking for maybe the oldest alumni around, and then Prof stepped forward. God just said, nobody can contend with that with her. And there's no contention. I hope you are going to pass that baton to somebody today as you retire and bow out from service. Congratulations once more, and we wish you all the very best.
Thank you very much, my very own provost. In the house with us today, we have a veteran, an elder, a former chief medical director of this hospital. Please welcome with me Professor Sonya Adeoye. Thank you so much for being around, sir. We welcome you. Very quickly, let me call to the podium let me welcome to the podium our very own DOG, Professor Dayo Shoade, Dean, Faculty of Clinical Sciences. You're welcome.
The chairperson for this occasion, Professor Mrs. Bickerstead, the Vice Chancellor, ably represented by Professor Adeoye Adenike. Kindly permit me to stand on the already well-established protocol before I start misjiving. I'm very, very much delighted to be here today because the person we are celebrating today is not just a person, it's almost like an enigma. And I have my reasons for saying that. You know, when we were residents, he was our senior, but we had a group, we always have a group. And we always ask ourselves, who is this auntie who has this gracious step, always well-dressed, and speaks very good Queen's English? It was then that we discovered that she actually went to a Queen's school. And even till today, she's a queen. She's a queen among all the lecturers that we have in the Faculty of Clinical Sciences. And I'm sure queens don't retire. They have more queens under them in the palace. Is it Palace of the Day now? It's just to appreciate you, ma, for all you have done and for all that you have achieved. A series of firsts. If I start mentioning first now, Babania Kariolua, I appreciate you and I wish you well. But I must also thank the Department of Ophthalmology for, arranging this. And it's just a reflection of one thing. There's one man that is called in my area there. And every time he always say it, Kashamashi Dada. And it has meaning. And it is one of those meaning that we are seeing today. If she has not been good, this will not have happened. And it's a lesson to also many of us that we should every time do the best that we can to make life not only better for our own self, but for the entire community. And look at these people sitting down here. In a way, I feel like retiring. But, I'm sure I've not done any good work. So may God bless you, man. And you will enjoy your retirement in prosperity and in good health. Thank you, man.
Thank you very much, sir. Acting on instruction and by the kind and special permission of the chairperson, please allow me to welcome to the podium to give his tribute the former Vice Chancellor of this great university, Obafemi Awolowo University. Please welcome with me Professor Ile-Ife for his tribute. You're welcome, sir. Please, let's keep clapping. Thank you.
Well, thank you very much. While I would like to stand on the existing protocol, I must acknowledge the chair of this occasion, Emeritus Professor Bickerstead, the Pro-Chancellor and Chairman of Council, Federal University, Benin Kebbi. Thank you very much, ma, for being part of this occasion. And our Baba, our Oga, Engineer Togonubika State. Thank you, sir. The representative of the Vice Chancellor, who is the Vice Chancellor for this occasion. And in any case, it looks more like the Vice Chancellor. That's Professor Adeoye, our guest lecturer. Thank you very much for coming all the way to bless us with your words of experience. The honoree of today, Professor Adenike Adeoye. Thank you very much, ma, for being what you are. All the members of the high table, please forgive me because of our time. The past vice chancellors, former vice chancellors that are here, the former CMDs that are here, the retired and serving professors that are here, our eminent members of the community who are here actually to show their appreciation to Professor Adeoye for the community eye program, you know, that she organized. Ẹ ṣé púpọ̀, ẹ ṣé tẹ́ wá. Nínú Bíbélì, wọ́n ní àwọn mẹ́wàá la ṣe lóore, ẹnìkan ló padà wá dúpẹ́. Ṣùgbọ́n nínú ẹnìkan tó padà wá dúpẹ́, ẹ̀yin jẹ́ kan ní ẹnìkan tó padà wá dúpẹ́ yẹn. So nǹkan tí Ọlọ́run ti ṣe fún yín, á jẹ́ àjẹmọ́nú fún yín o. Àjàgà tọ́lọ́run ti mú kúrò kò ní padà wá mọ́. Ẹ dàgbà, ẹ dògbó. Now, Professor Adegbengbe actually, recounted what I said when she came to me. I said, Professor Adeoye had been so good to so many people. I said, now that she's retiring, that we are going to take her back to Owo. Because our mother is from Owo, and Mama worked so hard in that place. So she must go there to continue, you know, what Mama did at the hospital there. So I said, yes, Ile-Oluji may have benefited a lot, but that we also, now she cannot complain that she doesn't have time to go to Owo. So don't ask me if I'm from Owo. You know I'm from Owo. That's why I'm pleading with her. Now, you know, she may not know this, but while we were students on this campus, clinical students, she was on residency program in the hospital. And one day, we were not very happy, all of us. And we said a lecturer on the campus was not fair to her. I won't go beyond that. It was very obvious. And we were saying that if this person could do this to her, then what is our fate as clinical students? So we were terribly afraid for ourselves, to the extent that coming to that posting was always a nightmare for us as students at that time. I'm not going to go beyond that one, but I'm sure maybe between me and her, I might give more information. But the way she carried out, the way she conducted herself, there is something about her. She's somebody that thrives in adversity. When some other people will fall by the wayside, she will go ahead, you know, to accomplish more. Today we are talking of the clinic, the ophthalmology clinic at Ile-Ife. Maybe that wouldn't have been there if not for what she faced. And instead of, you know, saying, no, I have to, you know, get my way out, get out of the way, she went ahead to do something spectacular, something extraordinary, even in the midst of all that. That is the kind of person that is sitting there today. And she's somebody who will do things in a very quiet way. Today, we say that the Faculty of Dentistry of Obafemi Awolowo University is the very first faculty in the university to have to have conducted a faculty conference. So when you list faculty conferences on the campus today, you will find that I think Faculty of Dentistry is on the 14th or so, and then that's the highest. So every other person will be number 5th faculty conference or the 8th faculty. But Faculty of Dentistry was the very first in the university to have a faculty conference. And when we were planning this, I didn't have the money. But I just wanted us, because I saw faculty conference in South Africa and everything, and I said we must come and do something like that, in OAU. And I started planning it. At the end of the day, the cost of the faculty conference at that time was 92,000 naira. This was in 2001. And 92,000 naira was a lot of money at that time. Professor Adeoye gave 10,000. Dr. Akintomide, now Professor Akintomide, gave 5,000. Those were the highest donations at that time. And when I got the envelope, I couldn't believe it. From Lighthouse, 10,000 naira. I said, So that was the motivating factor. And eventually, Professor Roger Makonjola, out of the 92, after we had conducted the whole thing and it was very successful, he said, "Are you owing?" I said, "Yes, we are owing a lot." So then he said, "We will give you 50,000 naira to offset whatever you are owing." And that was the very first faculty conference on the campus of Obafemi Awolowo University. Now, in 2021, I'm going to conclude here because I don't want to, I'm not here to, if you give me the whole day, I can talk about that. But Tabanika Kariolua. So, but I want to say something that the 1978 set, because it was in the very first set of graduates of Obafemi Awolowo University in 1978. They met in October 2018, 40 years, celebrating 40 years of graduation from Obafemi Awolowo University. That wouldn't have been possible without her. She was the one who actually organized everything, and they all came, and so in fact, it was the best of any reunion that I ever saw as Vice Chancellor over the 5 years. It was fantastic. Everything, efficiently arranged, and that is the person that we are celebrating. Ma, I want to say that as you, I will keep the other ones till another day. I will say that as you are retiring, as people have said, you are still very young, you are still very energetic, and I know also that you keep records. And also some of the photographs that people have been using actually came from her, even the photograph for Queen's School. So I don't have any photograph for my secondary school. So you keep all those records. It will be nice to look at people who are like you. People who are like you. People who are very rugged, people who are very compassionate, very committed. So, and probably put together like 10 of you, let's chronicle what you have been able to do, how you have been able to get to that level, particularly those that are women, females, and then put it together within the medical profession. So put it together in order to encourage those who are coming behind, that they must never give up. Nigeria may be what it is today, but they must never give up. It is good to japa if you want to japa, but even if you japa, when you get there, you will still face some other things. So there is always adversity everywhere, but people must always survive. So my prayer, ma, is that you will continue to grow stronger. The Lord will continue to renew your strength, and then you will live to very, very, very ripe old age. And all your heart's desires, the Lord will grant. We appreciate you. We thank you for your commitment. You are retiring, but you are not tired. And we will continue to call on you. Thank you very much, and God bless.
You know, I'm going to ask for another round of applause for our VC. Thank you so much, sir. Thank you. Let me quickly welcome Mrs. Dupe Ajayi Gbadebo, the President, Friends of Ijesha Land Geriatric Center, Ile-Ife, who is with us today. Thank you so much for coming. We welcome you. And I hear that Professor CEO Adeoye is on our way. We welcome her as she comes in. Very quickly to Professor CEO Adeoye. Thank you so much. You're welcome, ma. Thank you for being here with us. Thank you. To appreciate our guest lecturer for today, Professor Bekibele, please welcome with me Professor, our very own delectable, Professor Yemisi Amusa. Please welcome her with me to the podium to present the plaque to our guest lecturer. Thank you. Please let's keep clapping for her.
Thank you very much for bringing me to this celebration. Professor Adeoye, she's a role model and past president of M1. She has shown us how to do many things and we've learned a lot from her. So we rejoice with you today and your family. And I did a posting in ophthalmology, so I know what it means to be, at least I have an idea. So some of my teachers are here. So Akinshola, I thank you, Professor Bekibele, for honoring our own today with this erudite lecture. This is a token of our appreciation, and we pray that you two will grow old gracefully and be celebrated. Thank you very much.
Thank you very much. And we'll go very quickly into the presentation of gifts. And with the kind permission of the chairperson, let me go to my jurisdiction very quickly. I would like to call on representatives of the medical women. We know that the celebrations continue tomorrow, and we will have more time for tributes, for gift presentations. But very quickly, I would like to invite up to the podium members of the Medical Women Association of Nigeria, Osun State Chapter, ably led by the President, Dr. Bridget Omishere, for the presentation of their gifts. Please welcome them with me. If you have your sash in the house, just put it on and come to the front. Let's be colorful. Someone has my sash.
I have a message for you. God sent me to you. I have a message for you. God sent me to you. Listen, them say.
Please permit me to stand on existing protocol. On behalf of the Medical Women Association of Nigeria, Osun State Chapter, I bring you congratulatory messages from the National President of M1, Dr. Adekemi Otolori. I also bring you congratulatory message from the Southwest region of Medical Women Association of Nigeria. On behalf of Medical Women Association of Nigeria, particularly the Elders Forum, this morning, we'll be presenting you this gift. We want to say a big thank you to you. Like has been said, I don't want to say so many things. A lot has been said. She's a first in many areas. Our pioneer president, a strong pillar of support, a role model, an exemplary leader. We appreciate you, Ma. And we say, God bless you, and may you spend the rest of your days in prosperity and in pleasure. You will be far from pain in the mighty name of Jesus. Thank you, ma. Accept our token of love.
Thank you. A round of applause for the Medical Women Association of Nigeria Osun State Chapter. Very quickly, allow me to call on the Faculty of Clinical Sciences for the presentation of their gifts.
Yes, you will come again with a new song of praise. God is good. Oh, congratulations. 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 Say what the Lord has done for you.
I am still ordained until until tomorrow. Yeah, it's always a pleasure to appreciate people who have done well in the faculty, and she has done very well. And on behalf of the members of the Faculty of Clinical Sciences, we want to present this appreciation award to Professor Adenike Odumorayo Adeoye. It was yesterday that I learned where Odumorayo came from, and it's a very good story. On your 70th birthday and retirement from service, we want to thank you for your distinguished services and dedication to academic excellence and mentorship in the faculty. Happy retirement and best wishes.
So that you will hear congratulations, you're in the glory of God. Congratulations, He has done it for you, and you will come back with a new song to sing. God is good. Yes, you will.
Thank you very much.
With a new song of praise.
Very quickly, please allow me to call on the head of department, ophthalmology, Professor Benis Adegbengbe, to talk about the gift and present.
Thank you so much. Well, on behalf of the Department of Ophthalmology and our alumni, as I mentioned, we have gift for our retiring mentor and teacher. Unfortunately, the gift is so big. Honestly speaking, we could not bring it here. I actually asked them to project, but I don't know what is happening with them up there. But she's going to collect an handshake, and we are going to load the gift. So that's the gift we have for her. So we are loading it. We have to take a truck to carry them. We are loading it to her house. So thank you so much, and God bless you, my appreciate it.
Thank you very much. That's a good one. That's a great one. Thank you. Very quickly, I'm going to call on the Provost College of Health Sciences, Obafemi Awolowo University, to present their own gift. Please welcome with me, Professor Babatope Kolawole.
Come again with a new song of praise. God is good. Oh, congratulations. Congratulations. Congratulations, say what the Lord has done for you. Congratulations. God is good. Them say that can never be old. I've seen that. God's richer than that. Come back to with us.
Anyway, on the occasion of 75 days, meant to be glory of God, appreciation of all that He has done, and should continue to do. Thank you very much. Very regal. by mistake. Thank you. I am aware that there are people in the house that have their personal gifts for the celebrant. I'm going to ask Dr. Akinde to hold up her hand behind. Dr. Okore, I can see you behind. Please raise your hand. Please let's hand over our gifts to them, members of the Department of Ophthalmology. Thank you very much. Very quickly, for our time, let us go to the royal response from the celebrant herself. Ladies and gentlemen, please welcome with me Professor Adeoye.
Thank you, dear. I go always pray for you.
Why are you starting that music now? No, this is not the right time. You wait until I finish my speech before that music comes on. That's the order. Madam Chairperson, my very own sister, and all that is good. Thank you very much for accepting to chair this occasion, even at the shortest notice. I appreciate you, ma. And I'm going to request some tutorials on aging from you. Mr. Vice Chancellor, ably represented by Professor Adeoye. Thank you so much for coming. I'm sorry I skipped our Baba, Engineer Togonu Bikestep. I apologize. Thank you for coming. The Provost of the College of Health Sciences, the Dean of the Faculty of Clinical Sciences, my very own Dean, the Dean of Deans. Thank you. My Head of Department, Professor Adeoye, Head of Department of Ophthalmology. Before I mention the guest lecturer, my trainer, Dr. Femi Shueton, FRCS. And his beautiful wife, Fumi, who happened to have been my junior in Queen's School. I could still punish her, but for the fact that her husband trained me, I give her respect. Thank you, Fumi. Who have I not mentioned? The guest lecturer, Charles. Thank you ever so much for accepting to give this lecture to honor me. The Lord will honor you. Distinguished colleagues, senior, junior, professors here present, members of other professions. I see the nursing profession highly represented here. Thank you for coming. Family members and friends, and especially our dear Olori, Mama, the Olori Toriola, the Ogunshua of Modakeke. Thank you so much for honoring me. Kabiesi had informed me that he wouldn't be around, that he will represent him. And I thank you for doing this for me. I am grateful. Instead, I think people should know that Modakeke is my adopted town because my husband comes from Modakeke.
Ife is my town of abode. I started living here in 1971. 1971, I've been in Ife as a medical student. So I thank you for giving me the enabling environment to excel. Thank you, Ife. Ile-Ife. I spent 10 years working in Ile-Ife during the Modakeke-Ife crisis because I couldn't work in Ife then as a close relation of a Modakeke man. I don't know, those were painful periods. But thank God for giving me the grace to turn the affliction into something positive. And I want to appreciate Professor Anthony Arigbabu, who was the head of the Department of Surgery then. He insisted, because there was a lot of opposition for establishing another eye clinic in Ile-Ife. People in positions of authority then did not want to spend so much money equipping another eye clinic elsewhere. But Professor Arigbabu insisted that I should establish that eye clinic in the year 2000. And to God be the glory, that eye clinic has blossomed into our departmental outreach center. And I thank the Ijesha people for putting money together for establishing the Ijesha Land Geriatric Center, where we perform the operations in Ile-Ife. Thank you. I thank God for this beautiful day. I thank you all for honoring our invitation, the departmental invitation, because I had nothing to do with this. It was all the program of my Department of Ophthalmology. I thank God for Johnny Mercies for you all. And the technology available, I should hope there was Zoom connection or YouTube, something, somewhere along the line. Yes, yes. So for the opportunity of those who are not here, especially those who are in diaspora, you know, to view this. I thank you all for your affection. And really, someone said, to begin is great, but to end is even greater. So I want to appreciate you all for making the end of my service in OAU and OATHC memorable. Now, it has been a privilege for me to contribute to society through my work in OAU and OATHC. And like it's been said, I'm a person of firsts, not by design, but by, not by my personal design, but by God's design. I was in the experimental group. That's the first set of medical students, 1971 to 1978, who were treated as guinea pigs, you know, feeding us with so many forms of information, those that were needed and those that were not. And then, you know, just to see if we would survive, but we did survive. Now, I was the first resident doctor in ophthalmology in OATHC, and the first OATHC UCA trained ophthalmic surgeon. I also was the first to conduct a blindness survey in Osun State. And from that survey, I discovered that 1 out of every 10 persons, sorry, 1 out of every 100 persons was blind. That's a 1% blindness rate. And out of the blind, if you put together 10 blind people, 5 of them would have cataract. That was what stimulated my interest in cataract. Before I continue, I want to pay homage to all my teachers, right from primary school. There was a particular teacher I'll never forget. It was my primary 6 teacher, Mr. Ibitowa. I don't think I remember other teachers' names, but this particular one, every Monday morning, he will give us 2 sticks of the cane. That's in Ile-Ife Institute, Mokola Ibadan. Those of you know that private school. So he will give us 2 sticks, 2 sticks of cane. And he will say, that is to pep you up, to let you know that you have to work this week, to work hard. So actually the fear of that cane was the beginning of wisdom. I mean, you just had to work hard, whatever you did. So every Monday he would arrange us according to how you pass your continuous assessment on Friday. So there was a particular young man then, he's a doctor also, I don't know if he's here, Dr. Busola Adeoye. He was either first or I was, so we used to sit together. And then this teacher insisted that we learned the verses of the rhyme of the ancient mariner. I don't know if anybody has read that rhyme. Beautiful rhyme, beautiful. And such that for our valedictory service, Dr. Adeoye and I, Busola, had to recite that rhyme in front of parents and teachers. So it was such a very interesting time. I thank all my teachers that taught me in Queen's School and made me who I am today. I also thank my trainers in postgraduate, residency training program. There were, of course, Dr. Shueton started the training, and I later went to UCH to complete my training. There's a remarkable lady who is my friend and trainer, Professor Adeoye Adenike. Please stand up to recognize. That's my trainer. Thank you so much. Thank you for coming. The Lord will bless you and yours. Of course, there were so many other trainers. None of them, I couldn't bring all of them here, but I appreciate them. Now, I thank God for the different roles I've had to fill in the course of my service as an ophthalmic surgeon, a lecturer, a trainer, a mentor, a researcher, and a volunteer for community outreach programs. I thank God for putting me in the healing ministry. All of us medical doctors are healers. We're all in the healing ministry. Now, what happened last year? Oh, before I forget, Professor Becky Bele, I thank you. He was my, in UCH when I was chief resident. He was one of the junior residents, but very brilliant. And we've been together all this while. When I became the chairman of the Faculty of Ophthalmology, he was my secretary. A very calm, soft-spoken, intelligent, humble gentleman. Thank you, Charles. Now, in November 2021, that's over a year ago, the then head of department, Professor Tony Onakoya, where are you? Tony, yes. So she called to ask what I wanted the department to do for me during my valedictory, for my retirement. So I told her, as I sent a message quoting, "Good morning, Tony. I'm going to request for an eye camp as part of my retirement program, DV." And she responded, "Done, ma." But 3 months later, I had a rethink because I wondered how we were going to get so much money to organize an eye camp. Oftentimes we ask sponsors to donate money. And I just thought that in 2021, July, I delivered the Faculty of Ophthalmology lecture, and we asked people to donate money, and we were able to collect about 11 million, a little over 11 million naira for the Faculty of Ophthalmology. And I just wondered if we could still go around cap in hand, asking for funds from people. And I thought that would be insensitive. So I told Tony, I said, "No, Tony, maybe we should postpone it until I'm rich enough. Maybe by the time they pay my, whatever it is they pay at retirement, I'll be able to fund this program." But she insisted that somehow they will get money. And that was a promise kept. The Department of Ophthalmology, members, doctors levied themselves, collected money, got all the former trainees in Nigeria and abroad to, contribute money to execute these free eye surgeries. In addition, they were able to get a good donor in the name of Muritala Ibrahim in Olaji, who gave us 1 million naira, in addition to all that was collected. So the screening was done in Ife, Modakeke, and Ile-Ife. Those were the 3 areas where I worked. And then surgeries were performed in this, in Ijeshaland Geriatric Center and the Ife Teaching Hospital. I am indeed grateful to my department. I can't thank you enough. There's so much to say, but I think I should just conclude by appreciating everybody for coming, by appreciating Department of Ophthalmology that's all members of the department for their affection towards me. Like I keep saying, a tree does not make a forest. I didn't walk alone. I didn't achieve anything alone. We did it together. So thank you very much. And because of this, I am going to dedicate a song to ophthalmology department. And that's NOSA's "I go always pray for you. I go always pray for you.
I go always pray for you. Make the grace of Jesus see you through. I go always pray for you. As all of us, they go our separate ways. Na victory we go to tell when we see again of how God done bless me and bless you too. I go always pray for you. Even if I fall from you, you always in my heart. It's not true, not true. I just want to let you know, say, whatever I do, I go always pray for you. We go surely meet again. And when we meet again, none of us go day in shame. but not from glory to glory. In Jesus' name, we go surely meet again. Oh, if I offend you before, forgive me. So that when we see again, you know go get TPP for me. We all need each other to see life through. So I go always pray for you. And even if I fall from you, you go always in my heart. It's not true. I just want to let you know, say, whatever I do, I will always pray for you. Hey, and even if I fall from you, you will always be my heart. It's not true. I just want to let you know, say, whatever I do, I will always pray for you. Even if I'm far from you, you always in my heart. Not true. I love you with the love of Christ. I just want to let you know, say, whatever I do, I go always pray for you. Say, make the grace of God no come out and make him peace. Never see the power upon you. Whatever you do, and him love to see you through. I just want to let you know, say, whatever I do, I go surely pray for you. Even if I'm far from you, you go always in my heart, that's true. I just want to let you know, say, whatever I do, I go always pray for you. I don't go forget, hey, they always pray for you. And even if I fall from you.
Thank you. Ladies and gentlemen, I think it's time for an ovation for the celebrant, Professor Adeoye Adenike. Thank you so much, ma. Let's give a rousing round of applause. She more than deserves it. A beautiful lady, hardworking, of many firsts. God bless you so richly, ma. Thank you so much. Congratulations again. Please, we may have our seats. Very quickly, as we round up, I'm going to call on the chairperson of this occasion, Professor Fumi Togonubikestet, for her closing remarks. Let's give a rousing round of applause, ladies and gentlemen.
Well, Prof, that was highly inspiring. Highly inspiring. I would not go over the protocols because they've been fully established. I want to start by first thanking the Department of Ophthalmology that have put out this program and have so successfully implemented it. Please give them a round of applause. I want to also thank the lecturer, the guest lecturer. You have given us a lot of take-homes, things to consider. Unfortunately, we can't ask questions. I was told that I'm not allowed to ask questions. I had a lot of questions I would have liked to ask you, but I'll ask after this meeting. One of the things is that responding to the issue of cataract blindness is for all of us. It's a challenge for all of us. And I'm sure that people have ideas that they want to share with you later after this ceremony. The person we are celebrating today, who has given us this uncommon opportunity to witness what happens when you have led a life of impact. Professor Adeoye, you have led a life of impact. And it's a lesson to all of us. While we're in office, how is your everyday work impacting others? Because if you live well, you are successful, but have left no impact, You have not lived at all. So Nike, congratulations for living very well. We've also benefited, not only in terms of knowledge about blindness and whatever, about impact to the community as an example. So we can begin to think by ourselves, in my own profession, in my own discipline, what can I do to go beyond the classroom to impact life? You have impacted life, and this is the evidence. I really, what else to say? I sat here very inspired, very carried away. I know that the audience has been blessed by being here. It has not been a time spent in the normal lecture where you listen to big grammar and nothing comes from it. We are going home blessed. We are going home equipped. We are going home sensitive to asking ourselves the question, am I living in impact? Is my life impact others? Do I have mentees that I can point to and say, this person benefited from my knowledge? I also have mentors that I can say to them, thank you for making me who I am. Above all else, I think Nika is thanking God. She's thanking God. And I think that's what we need to take away from here. The heart of gratitude from wherever we are. Nika, once again, congratulations. Thank you.
Thank you very much to our chairperson of the occasion. Right now, please allow me to call on another delectable very young lady who is going to give the vote of thanks. It's a good thing to give thanks. Please welcome with me to the podium, Professor O.H. Onokoya.
The chairperson of today's occasion, Professor Funmi Estate, all other protocols duly observed. I am here on behalf of the Department of Ophthalmology to say thank you to everyone. It is with sincere gratitude to God and a thankful heart for having the person of Professor Adenike Odumurayo Adeoye, who had been with us all these years and obviously had been impacting us, that we want to thank every one of you for being present here today. It is with great joy and delight that we celebrate this very wonderful woman. For many of us, she went from being trainer, teacher, mentor, friend, family, almost anything you can think of. She had thanked most people. The chairperson has also thanked most people, but I'll still go ahead and say thank you on behalf of the department to the chairperson, Professor Bikestekma. Thank you for gracing this occasion, and thank you for coming along with Daddy. Thank you, sir, for being present here. I want to say thank you to the Vice Chancellor's representative. Thank you, sir. Thank you, our provost, our dean, representative of the acting Chief Medical Director of Obafemi Awolowo University Teaching Hospital. In ophthalmology, we see that we have trainers and teachers that retire but graciously remain very strong and active. You can see that Professor Adeoye is joining Dr. Shoeton, who also had been our trainer. Thank you very much, sir, for coming and for coming with Professor Mrs. Funmi Shoeton. I do not know whether I should say thank you to my head of department who asked me to say thank you to everybody. But thank you, Professor Adegbengbe, for sitting down there also. Thank you, Professor Becky, my Babaoko. Thank you for making it very easy to reach out to you to give this lecture. Thank you very much. Want to again thank the Olori for being present here from the beginning to the end of the program. Thank you, ma'am. We want to thank all ophthalmologists. Yes, I can say all ophthalmologists, but it is impossible not to single out Professor Ashaye aka Mama Ashaye. Thank you, Ma. Her smile can train you. Everything can teach you. Her steps will teach you. Thank you, Ma. I'll go ahead and thank every member of the College of Health Sciences and the faculty, very senior members that are here, past provosts, past deans, present provosts, present deans, past CMDs, past vice chancellor. Thank you very much for being present and sitting calmly at this kind of time from the beginning to the end. Thank you very much. I would not forget to thank the family members of our Mama. Along the line, they had almost become part of the Department of Ophthalmology. We celebrated weddings together. You would not know that when your babies came, we were also celebrating here for the grandchildren together. Thank you, the Adeoyes, Adenikes, and other family members. Thank you for members of the hospital community that are here, optometrists, nurses, other administrators. I would not forget to thank the Obafemi Awolowo University Teaching Hospital Department of Ophthalmology alumni, home and abroad. Thank you very much. You gave so much. You kept prompting, what are we doing for Mama? Is everything okay? What else can we give? Thank you very much for your care. Ma, a lot of people love you. You impacted a lot and everybody did what they did very easily. They wanted to do more. Thank you very much for doing all that you did. I would not forget to thank the people who benefited from the surgeries also. Thank you for trusting to receive. Some people do not know how to receive free gifts. Thank you for receiving the free gifts. And I will not forget our MC for today, Dr. Boladale Makpai. The next time you see me, don't develop blood pressure. Just be calm that we are together in ophthalmology. I would want to say to everyone, thank you, thank you, thank you, thank you, and thank you again.
Thank you very much, Professor Nopoya. And let me just say to you, I will pray for you. So, ladies and gentlemen, we've come almost to the end of this program. And just before we round up, please allow me to call on an elder statesman that we have in the house for our closing prayer. Please welcome with me Dr. Shoeton. Give us an opening. Closing prayer.
Please can we rise up as we pray? Heavenly Father, we are so grateful for this occasion. Lord, we thank you for the life of our very dear sister, your daughter, Professor Adeoye. Lord, we are so grateful to you. Thank you, Lord, for the way you've been with her, the way you've raised her up, and the way you have made her a blessing. We give glory to your name. We praise you and we bless you. Thank you for bringing all of us here from various places to just rejoice and celebrate with her, and for making this occasion one of real and great celebration. We give you all the praise and all the glory. And we ask, Lord, as everyone will be going back, that they will arrive safely at the various destinations. Thank you, precious Father. And we pray, Lord, that our dear sister will grow gracefully. She will experience all-round enlargement, spiritually, emotionally, physically, materially, to the glory of your name. We pray and we ask all this in Jesus' name. Amen.
Thank you very much, sir. Thank you very much. Hold on, ladies and gentlemen. Just before we leave, we will take very quickly the OAU anthem and then the national anthem in quick succession. Thank you. IT, are we together? Oluwada Mama Si. Thank you very much. Hold on, ladies and gentlemen, just before we leave, we will take very quickly the OAU anthem and then the national anthem. Thank you.
Sports and struggle, great effect. I love you. There's only one great effect in the universe. Another great effect is a counterfeit. Grace, 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 grace.
Great effect. Thank you very much, ladies and gentlemen. Please let's wait for pictures outside with the celebrant. We're taking pictures outside, ladies and gentlemen. Thank you very much, ladies and gentlemen. Wait for pictures outside with the celebrant. We're taking pictures outside, ladies and gentlemen.
Respect for humanity. She walks with cordiality. She takes every people along, and above all, she's a very family woman. She has respect for the family. She takes care of her children.
Now they play master. People are thinking very government in the place. Master. That's all. College, college. Yes, sir. Yes, sir. Yes, sir. Okay, I'm okay. No, mo fẹ́ miss ẹ̀ papọ̀ mọ́. Mo fẹ́ miss ẹ̀ mọ́ ẹ̀ lé. Voice was more low. So music pẹ̀lú kan lọ́ba. Nígbà mẹ́ẹ̀ jẹ́ ọ́n ní yá sí yá sí. Máa ra lórí sórí àpò pé ọmọ kan sọ̀rọ̀. Okay, sir. Mama, after... Okay. Okay. Huh? Okay. Yes. Okay, so this video here, do I prefer YouTube video? I go download a complete load from Professor Peace out. I think you know. All right, so that's you talking about. Drop that.